So thank you, everybody, for joining. Thank you for your patience with working out some technical difficulties. So actually, we're going to start right off today with Dr. Michael Mendoza, who's going to walk through the latest information that we have on our numbers and give some insights into what he's seeing in numbers in our community.
Thank you, Executive Bello. And can everybody see the bar graph in your screen? I wanted to spend a few moments looking at these numbers. As you can see here, and what I'm showing to you here are the confirmed COVID cases in Monroe County by the date of when the test is collected. So as you all know, every day we report the number of cases that we learn about on any given date. But you should know that on any given date, the results that we learn about represent a range of dates of when tests were actually done, meaning the person went and got their test on different days, but those results all come back on a given day, and those are the results that we report, say, yesterday. So we had a report of 86 yesterday. Those 86 test results actually represent a range of dates of representing when patients went and actually got the test done. I say all that to say that yesterday's increase was certainly alarming, but doesn't actually represent 86 new cases on a given day. And so what I'm showing to you here are the new cases by the date of when the test was done. And so this is a more accurate representation of how the numbers are increasing, and I will say, yes, they are increasing, and they are increasing somewhat more rapidly here in the last couple of weeks. So what we're looking at here, as I see it, are really two separate phenomena. One is what we reported yesterday, which is that we are seeing an increased number of these microclusters. So these clusters of individuals who are close-knit, who gather together, who may represent a particular group like St. John's Fisher campus, as you know. But the one thing that unifies all of them is that they gather together. And so what you're seeing here is a definite increase in the number of people positive. And in large majority, we think that the reason for this increase is these clusters, these microclusters of people who gather. Now, I will say that as we look at these numbers, and as I've looked at these numbers since the beginning, we want to try to distinguish clusters, which we are identifying through tracing and through testing, and that's why the percent positivity rate is going up among these people in whom we think the likelihood of being positive is greater because they're contacts of known cases. We have that group of individuals, and then we also have the rest of the county, the community transmission rate, if you will. And there are really two types of increases in rate. And so I want to make sure that people understand that, and I can go into that a little bit further when we get into the questions. So my message here today is, again, if you're sick, stay home. I will say that in the recent couple of weeks, we're seeing more people who have allergies, and they are saying that they, oh, stop sharing, good. Let's see, I'll stop sharing here. Sorry. So my message is this. Number one, stay home if you're sick. We have been hearing of, I've been seeing more individuals who are testing positive with symptoms who report as their symptoms that they're used to as having with their usual allergies. And so I want to make sure that people understand that if you have allergy symptoms, even though you may have known allergic rhinitis, please do think about whether you might have COVID. Number two is please wear your mask. We know that masks are very important, particularly as we go indoors, particularly as the weather is getting colder. We want to make sure everybody's wearing their mask as much as possible. And number three, be thoughtful about your gatherings. And I say this with Halloween and the Thanksgiving and winter holidays on the horizon. I want us to be thinking about those people in our circle who we're gathering with. Because as we want to try to connect with our loved ones and our family, potentially from other states and other parts of the country, we want to do everything we can to keep our local rate low, both to keep ourselves healthy and safe, as well as to prevent transmission to people who might be coming in to visit. And it's particularly important that we think about this now because we want to be thinking in terms of 2-week windows. So we're within 2 weeks now of Halloween. As we enter that period where it's less than 2 weeks before Thanksgiving, I want to make sure we'll reiterate that message again. But to be mindful about who you're gathering with, how you're gathering. If you're going to gather indoors, especially indoors, please make sure you're wearing your mask. If you're outdoors, that's safer, but it's still good to wear your mask. and then try to be thoughtful about that physical distancing component, because we know that that makes a difference. And certainly indoors it's harder, and that's why it's all the more important to wear your mask. So with that, I'll turn it back over to County Executive Bello, and then I imagine we'll have many questions after that. So thank you for now.
Great, thank you, Dr. Mendoza, for that update. I know you and your staff continue to work countless hours to help keep our community safe, and we're all really grateful for your efforts. As we navigated the COVID-19 pandemic over the last several months, we've done so in a way that's kept our community spread low, thanks to the cooperation and hard work of so many people in our community and so many residents. And you know, that was never more evident over the last several weeks when members of the Monroe County Department of Public Health, New York State, the city of Rochester stood up a COVID-19 testing and flu shot clinic at local churches throughout the city of Rochester. This initiative would not have been possible without our community partners, including the Black Physicians Network of Greater Rochester, the Rochester Black Nurses Association, Common Ground Health, Finger-Based Performing Provider System, Jordan Health, Ibero-American Action League, Rochester Regional Health Reach, and the University of Rochester and Whiteman's. And I want to thank you very much for all of your support and hard work in standing that up. The success of this initiative is undeniable. More than 1,000 hours over the 2-week span resulted in 941 health screenings, 764 COVID-19 tests, 466 flu vaccinations, and over 100 people trained in how to properly administer Narcan and were provided an Narcan kit. As I said earlier, this would not have been possible without our incredible community partners, particularly Dr. Linda Clark from Common Ground Health and Dr. Amadi Velez de Brown, our Deputy Commissioner of Public Health, and the pastors of Enon Missionary Baptist Church, Greater Harvest Church, Memorial AME Zion Church, and the House of Prayer and Restoration. Their boots on the ground approach brought these services right into the community, helping those in need of critical services. So on behalf of myself and Dr. Mendoza and our entire community, I just want to say thank you again. We're grateful for your collaboration and your success. I also want to address Halloween. Halloween is right around the corner. With the cooler weather also means we're spending more time indoors, and our new and active cases, as Dr. Mendoza just showed you, are slowly rising. So now is a good time to think as a community, as a family, in our neighborhoods about the actions that we can all take to continue to protect ourselves and keep our community safe. Just this week, New York State released their Halloween guidelines for 2020, which followed the Monroe County Department of Public Health's tips released earlier this month. The reality is that there are a lot of fun and safe ways to celebrate Halloween this year. If done properly, trick-or-treating is safe. Outdoors with your immediate family, staying 6 feet apart from others, while regularly sanitizing your hands. And if you do plan to hand out candy, doing so while wearing proper face covering is highly recommended. What we don't want to see, though, are those large indoor gatherings, costume parties, house parties, or bonfires. We put a number of tips on our website that you can check out on how to safely celebrate Halloween, but I really want to stress to the community. So I know we had a lot of questions. I myself have 2 young kids who are really looking forward to Halloween myself. And it's a delicate balancing act because you want to be able to celebrate the holiday, celebrate Halloween, have that fun experience that we normally have, but we just have to tweak it slightly so that we can do it in a safe way to prevent the spread from growing throughout the community. So like I said, if we're going to go out trick-or-treating, we need to make sure we stay within our families, wear masks, stay 6 feet apart, and if you're handing out candy, remember the simple trick we talked about last week. If you're participating in trick-or-treating, turn your lights on. If you do not want trick-or-treaters coming to your door, keep your lights off. If you are feeling sick, if you have symptoms of COVID, or if you're isolated or quarantined at home, please do not also engage in trick-or-treating activities. And obviously, if you are at risk of developing severe symptoms for COVID-19, we'd ask you not to do that as well. So please be smart and be thoughtful about how we engage in celebrating Halloween with our families, but also doing it in a way that's mindful that COVID-19 is still here. We are not out of the woods by any stretch of the imagination. Dr. Mendoza just walked through some increasing numbers that we've had in our community. So we all have a role to play to work together, as we did earlier this year, to bring that curve down and keep our spread low and keep the infection rate as low as possible. If we can do that, then we're going to be able to continue to get through the next stages of opening the economy. Movie theaters are allowed to start opening, I believe it's tomorrow. And we'll be able to continue to see those openings into the future, but only if we can keep that spread low. So as we engage in these activities, Halloween, Thanksgiving is coming up as well. We have to think about ways that we can do so while protecting each other, protecting our families, protecting the most vulnerable people amongst us. So the other thing I'd like to remind the community of is a couple programs that exist. Here, MCC is still continuing to offer free COVID-19 testing to all residents. Here, you just go to our website, monroecounty.gov, to the MCC parking lot, and this is the site that is stood up by New York State Department of Health. So it's free COVID testing is still available there. I'd also like to remind residents, anyone who is facing eviction or foreclosure due to a financial hardship caused by COVID-19, to please call 211. There are dollars that have been allocated through the CARES Act to be able to help pay back rent, and that was the result of losses from COVID-19 and help our residents stay in their homes. So again, it's as simple as a phone call to 211. And there's a screening process over the phone. So again, if you are facing eviction or foreclosure or behind your payments because of COVID-19, 211 is the place to go. I'd also like to remind the community that just yesterday we announced our Fast Forward Monroe program to help small businesses in our community who are economically impacted by COVID-19 and are struggling as they face the upcoming winter months to navigate that. On our website, www.monroecounty.gov/fastforwardmonroe, we have program details and the application is online as well. But this is for small businesses up to 50 employees to receive support and resources to help get through the next several months as we enter the winter. So with that, I will open it up. I think Julie, you'll manage questions today from the media.
Thank you. Our first question comes from Gary Craig with the Democrat and Chronicle.
Thanks, Julie. Thanks, everybody. I assume people are going to ask bigger picture questions after I, because I'm going to ask a little bit in the weeds here. That's probably been answered before, but you probably saw Genesee Brewery today said that they had, Brewhouse said that they had an employee who tested positive and they were putting the they said that that was done of their own decision making, not necessarily from recommendations from DOH. And I'm curious, when is it you decide that we need to get the word out because there's a possibility of folks being in contact with somebody at place A, B, or C? Is that decision, and how's that decision made?
Thanks, Gary, for your question. So very often people will learn about their result before we do. Because of the way the results make it through the system, often patients will hear of their results immediately and it will take some time before we learn about it, and that was the case here. And so we now know about this result. We are looking into it. We're beginning the contact tracing. And I'm grateful for Genesee Brewery to have taken this step out of an abundance of caution so that we can have an opportunity to go in, investigate what happened, and determine if they have done everything correctly and there's nothing further to do, or if there is additional work that we need to do. That determination is really made based on our investigation. And so our goal when we contact people is to identify all of the people that they were in contact with who are at risk, at greater risk for having contracted the infection through contact. If we can identify all of those people and we're confident in that conclusion, then generally we won't need to make a general advisory announcement to the public. But if, as we've done in the past, if we're unable to identify either because the person doesn't recall or doesn't know exactly who was within 6 feet of them for a certain amount of time, then we will issue a public advisory, and that really is to inform the public because we're not in a position where we're going to be able to identify those individuals. So we're not yet at that point in the Genesee Brewhouse investigation, but we will be later on today.
Thank you.
Do you have a follow-up, Gary?
No, that answered it perfectly. Thanks so much. Thanks.
Okay, next up is Alex Crichton from WXXI.
Thanks, Drew. To go this road. Dr. Mendoza, do you have today's numbers regarding infections? And once again, go exactly, what do they mean as far as this date range goes?
So we don't have the final number just yet. We're going through those numbers, but on any given day, the numbers that we report represent the cases that we have verified and confirmed ending at the midnight of the night before. And so we're still going through yesterday's numbers, and then when we finalize those, we'll release those later on this afternoon. I didn't hear the second half of your question, Alex.
Actually, I just wanted to know, maybe you can go a little bit more into COVID fatigue. You know, what is it? How dangerous is it? And, you know, how do we counteract that?
You know, I think everybody has a sense of what COVID fatigue is. I feel it. I think everybody feels it. Everybody is just waiting for the day when this can all be over. And from my standpoint, you know, we don't have the luxury of letting go, because this virus shows no signs of stopping. And so as tired as we are of perhaps wearing a mask, of being mindful of all of these things that we're ordinarily not needing to be mindful of, I do think we need to keep pushing. And it's hard. I totally understand that. I think what we're seeing in terms of COVID fatigue as it pans out in these numbers is that people may be getting lax. I don't think the vast majority of the public is doing that. I think if the vast majority of the public was getting, was letting their guard down, we wouldn't see numbers really as good as we're seeing. You know, certainly the numbers are going up, but again, they're not going up nearly as fast as we're seeing elsewhere in the country. So I think on balance, we're doing very well as a community, and I just want to keep us going in the right direction as we head into these more risky months. But I think everybody has a good sense of what that pandemic fatigue is.
Yeah, and I would just add, you know, one of the ways I think we were very successful earlier this year, as we were seeing a large number and then we started coming down the hill there, is that, you know, obviously summer came, we came outside and people started, it was easier to spread apart, it was easier to be outside and more to spread that way. The concern here is that now, you know, you have, along with COVID fatigue and you know, getting tired of all these restrictions that have been put in place, we're now going back inside again. One of the things that worked, I think, well earlier this year was being thoughtful about how we can still continue to do things the way we've always done them, right? We're still going to celebrate Halloween. We're still going to celebrate Thanksgiving. But you have to think about ways to do it just a little bit differently. So you're being mindful and thoughtful about how to prevent the spread of the disease. So, you know, even when we talked about Halloween just a minute ago, we can still celebrate Halloween. What we can't do is have 30, 40, 50 people in our house doing costume parties or candy exchanges. That's not going to work. We have to wear our masks, stay 6 feet apart, and think about, well, how can we go trick-or-treating in a way that is responsible where we're not spreading the disease? How can we still hand out candy to kids who are coming up our walkway in a way where we're not coming in direct contact and coming within the 6 feet of each other? There's a way to do it. We just have to be creative about it, just like we were earlier this year with the Easter holiday, with Mother's Day, with Father's Day. We found a lot of great ways to be able to still celebrate those holidays, but you just have to think about doing just a little bit better.
Thank you, Alex. Tanner Jubinville is next from 13 WAM.
Hi, good afternoon. First question, just in regards to contact tracing, I guess, are there, over the last week or two, I guess, any sort of trends, patterns, anything's popping up in terms of, you know, what they're attributing new cases to, maybe things people are doing, places people are going?
Yeah, it's a good question, Tanner. As before, there isn't one hotspot per se. You know, the hotspot really is where everybody is gathering, and that has been the unifying theme here, is that people are gathering, and when they gather, it's very likely that they will share the infection with one another. And then what we're seeing then is, because these people don't believe that they're at risk, they go home, and then the rest of their household turns up positive as well. And so, you know, depending on how large a household is, that tends to cause these, you know, peaks and valleys, if you will, in the data. But the unifying theme here is that there are gatherings happening, and my sense is that there are more gatherings happening with more people present, perhaps not using their precautions wisely. And so I think that is the explanation for, from my standpoint, as to why we're seeing an increase in these numbers and the sizes of these microclusters. And again, I want to distinguish that from community spread, which we're not able to measure as well. I think it's harder to measure community spread. But my sense in looking at the data overall is that it's likely that that's increasing, but at a much slower rate than what you're seeing in the daily numbers.
A follow-up to that, I guess I'm sure things are starting to pick up again for the tracers. Is there any, I guess, are there any efforts to boost the numbers before the, autumn, winter, as we continue into fall and then ahead of the winter months?
Yeah. So I certainly don't want this to happen, but I am preparing our staff. I've asked our staff to shift our workforce back to contact tracing and case investigation, not unlike where we were in April and May. And my hope is that we won't need to do this, but I am making those preparations now in anticipation so that we're prepared if and when the numbers do go up.
Okay, Christian Garzone from WROC, you're up.
Yes, go ahead. Well, as you know, flu and COVID are very different, and this year we're bracing ourselves for what we've never been through before, which is the potential to have two of these seasons overlapping with one another. Best I've heard lately is that we're really still in the single digits in terms of numbers of confirmed flu cases here in Monroe County, which, as you'll probably recall, in normal years at this time of the year, we will have seen far greater numbers in terms of influenza. So my hope is, and it is so far so good, that the numbers in flu might be lower as a result of us implementing the masking and hand washing and distancing and all of the things that we're doing for COVID-19. We saw in the Southern Hemisphere that the flu season was a little bit quieter, if you will, and the hope is that that will be the case here in Western New York as well.
Yeah, no, it's a great question. As of this morning, we had roughly 800 applications came in already, which I'll say this, demonstrates what the need is for this program. That's a lot of businesses so far have applied. It demonstrates just how needed this kind of support is for us.
Thank you, Christian. Mary McCombs from Spectrum is next.
Okay. Can you hear me?
Yes, go ahead.
Okay, great. This question may be directed towards Dr. Mendoza. I'm not sure if you're familiar, but we've heard this concept. Washington Post article recently, I believe, where they spoke with some experts from the Mayo Clinic just to talk a little bit about why this is becoming such an appeal for people. The quote unquote quarantine pods or bubbles where, obviously it's appealing for socialization factor, but in your opinion, do you think these can be done effectively?
I think they're difficult. They can be done. National Football League is trying to do this, and it's difficult. It takes a lot of discipline. I think the most important theme is to understand the principle, which is that you want to try to understand the collective risk in whatever group you may be interacting with. And so my daughter, for example, is a field hockey player. And so her bubble includes the field hockey players on her team, as well as the parents and family of those players. That is somewhat of a bubble. And so when I think of the risk associated with her playing field hockey, I think about the collective risk of that group of people. And then, of course, we have friends and family and so forth. And so these intersecting bubbles, are hard to keep distinguished, particularly as our community is open as it is now. And, but I think it is a difficult concept to try to actualize. I think I think the theme is right. I think the principle is that we want to try to understand the risk of those who we are gathering with. But I think the bigger message is that you really just don't know. I mean, you can't know in the same way that I can't know if I have an infection right now. I don't feel any symptoms, and I'd like to think I don't, but I have to proceed as though I may, and that's why I take the precautions that I do, wearing a mask and keeping distant from other people. So I think the overriding principle is that we should be taking these precautions no matter what we're doing.
Okay, thank you. My second question is kind of encompassing both the flu and COVID as we head into these critical months here. Visitors, restrictions in hospitals, at what point might we see limitations again going on at some of the local facilities here?
Well, we just had a conference call yesterday with both hospital systems, and we are talking about how to proceed with that. As you know, visitor procedures are not as usual even now. And so, we're going to be having those discussions, and we'll be issuing our recommendation, and we're going to implement them as a community, as a uniform community. So both U of R and Rochester Regional will all be implementing these restrictions at the same time.
Thank you.
Patty Singer from Minority Reporter.
Hi, I was multitasking. The county executive praised the effort of the churches with the community testing. I know I asked you last week. I'll ask you again this week with all the praise heaped on it. I'm sure there is still a need for this. How is this going to continue?
That's a good question, Patty. We're in those conversations right now about how to expand that, and we've also an additional focus, though, on top of the COVID-19 testing is how do we distribute the flu vaccine to as wide a population as possible as well. So what the conversation is now is about whether or not we can continue to do stand-up those type of events around the community, but how do we get the message out that the flu shot as well is very important. Flu vaccine is very important as well. So I don't have an update for you now on new dates and locations, but that's a conversation that we have to have because we particularly need to make sure that the flu vaccine is available as possible as well.
Thanks. And for Dr. Mendoza, I don't know if we're parsing words here, but cluster versus community, is that just a semantics, or is there really something behind that? Because I'm confused what is going to separate a cluster from community transmission.
No, they're actually very distinct concepts. So let me try to explain it more clearly. Clusters are people where we have an epidemiologic link that we can identify through contact tracing. And so in general, although we might find a large cluster, that won't give me as much pause as, say, finding a smaller number of people in whom we are unable to find an epi-link to explain how they got the infection. So, for example, if there's a large church and a large number of people in that church became infected as a result of a super spreader type event, we have a very clear explanation there, and we can quarantine those individuals, and provided that they follow through with our recommendations, they don't present a general risk to the public. But by contrast, if you have a smaller group or a larger group in whom we are unable to identify how they got that infection, that will give me more concern because we won't necessarily be able to identify all of the contacts nor how they acquired the infection. And so distinguishing between these clusters, which we're seeing primarily now, and community spread, which is sort of unexplained spread in the community, I think is very important. And so I'm trying to understand, and we've always been trying to understand, it's very hard to measure the extent to which there's community spread. And so they're very distinct concepts that we're seeing both at play in our numbers.
Okay, Jennifer Lukey from WHEC is up next.
Hello, I'm wondering, Dr. Mendoza, looking at yesterday's numbers, and you talking about clusters specifically, if I'm at home listening, I'm saying, where are these clusters? Like there's a group of 60-year-old women, 12 of them yesterday. What is the source of that cluster? Obviously we know about Nazareth and St. John Fisher College sort of accounting for some of those numbers, but where are these other clusters in our community?
So there isn't a single demographic zip code or a geographic area or workplace or business that we can tie all of these cases to. They're sporadic clusters, and we call them microclusters because truly they're households. They're small groups of people. They may be related through social gatherings and weekend events and so forth. So there isn't a unifying theme, if you will, that ties all of these cases together. Today, for example, a large number, I think 25% of the cases today are all going to be tied to the Fisher cluster. So today we'll have a higher than usual number of people in whom we identify the cluster, in advance. but that number changes from day to day. So I think the unifying factor here is that social gathering of people, usually in small groups, honestly, usually in small groups, but perhaps not taking those precautions and inadvertently transmitting the infection.
And speaking of the Fisher and NAS clusters, we've gotten a lot of questions from parents about the decisions that different colleges are making. Some are keeping kids on campus to quarantine here sort of while continuing the remote learning. Others are sending them home, and parents are saying, wait, if they're in these clusters, why am I getting them home to possibly spread? We also heard that some of the colleges are telling kids to grab an Uber to get to the hotel to quarantine. And I'm just wondering if you have some concerns about that, knowing that these Uber drivers may not realize that these kids have been exposed.
Well, the guidance that we've offered to the schools has been if you've got an isolation, a person who's confirmed, to isolate, to stay in place. We don't want those people going anywhere. We don't want them taking an Uber. We don't want them, taking any form of transportation. We want them to finish out their isolation here. People who are under quarantine, we want them to stay here as well. Now, the reality is we can't make them stay here, and it really lives with the college or university as to how they want to proceed with that. But our recommendation is that we want them to stay here because that's the safer thing to do. We know, where they are, and we don't want to inadvertently spread the infection to another neighboring county or state. But no, we wouldn't advocate for, people taking an Uber if they're under quarantine.
Okay, Gino Finelli from City Newspaper.
How you doing? So Dr. Mendoza, I want to touch on something you said a little bit earlier on the people having symptoms of allergies or things that they, normally have year to year, and, just opting not to get tested or just thinking like, oh, this is something I can shrug off. We're in the season right now where this is going to be something that's going to be continuing to happen. People are going to get colds and things like that and have these symptoms and not really think to go get tested or to really concern themselves with it. How are you approaching that right now of convincing people, yes, you need to get tested if you're having any sort of symptoms when there are other things going around that could be giving you those symptoms?
It's a really tough problem. The reality is that you really can't distinguish when you have congestion and runny nose. You really can't know if that's allergies or something else, and it all sort of depends on sort of the environment. And in a normal environment in any other year, if you've got symptoms of allergies, it's pretty likely to be allergies. But this year we have a new kid in town, and so we've got to be considering other possibilities. I would encourage everybody who has these symptoms to reach out to their healthcare provider and try to get guidance on how to make that distinction. I don't want people to try to make this decision on their own. And until they do that, to proceed as though they may have the infection. Wear your mask, take these precautions. In healthcare, we call them universal precautions because we can't know everything about everybody we come into contact with in a clinical setting. And so we use universal precautions so that we don't have to worry about it, honestly. So we take all these precautions. We don't try to make distinctions when it's not frankly possible to do that. We apply universal precautions, and in that way we keep everybody and our patients safe. And so I would want to advocate for the same, in the general public.
And this is a sort of an odd question, but, when COVID first happened, it was something that dominated news cycles. It was the top of everyone's thoughts right now. Now we have a presidential election happening, and there's just so many things going on in the world that people are just, I think, fragmented a little bit. They don't know what to actually pay attention to. So I want to get your perspective on how people, how do you keep people this in the front of their minds, that they're, constantly knowing this is here and it's an important thing to be paying attention to when there's so much else going on in the world, and some people just might be like, oh, I'm just forgetting about that right now.
Well, Gino, I'll start, and then Dr. Mendoza has some thoughts on this, but a couple of things. First is that's why we started these weekly briefings again, just to make sure that we're still engaged, we're still aware, and that we understand what to make of the numbers. Particularly as you start to see increases here, it's important for the community to understand why and what it means and how it relates to the rate of infection versus the total number of cases we have, because it changes because it's important to understand in context of the number of tests that are being conducted. But I have been frustrated on the lack of what I thought was a national strategy, a testing strategy, a messaging strategy on this from the beginning. This should have been a much more national strategy and message to the nation about how we keep the spread of this disease down, because COVID-19 doesn't know borders. It doesn't know the county borders, which is why we operate as a region. It doesn't know state borders. So what happens in other parts of the country is by definition going to impact what happens here. That is related to the spread of the disease. It's also related to how the testing works. When you go back earlier this year, we had very little capacity for testing here. We're doing the best that we can now. We're testing more people now than we ever have before. But this really wasn't the case earlier this year. And I also think that we've seen some very poor public examples of leadership from across the country. COVID-19 shouldn't be political. Wearing a mask shouldn't be a political statement. It should be an act of public health. It should be an act of caring about your community, about your family, and about your neighbors. The disease is still here. It's still spreading. The numbers we release every day, going back to March, you're still seeing that. And it's going to continue to happen. Our goal, and the goal of this community, should be to keep that spread as low as possible, to prevent the disease from impacting those who are more at risk for some serious health consequences for catching a disease. That's why we wear a mask, we stay 6 feet apart, we try to keep this away from folks who are older and folks who are immune compromised. And I will say this though, despite my frustrations that I think have existed on the national level, we here in Monroe County and the Finger Lakes region, I think have done a really great job. And I'm not just talking about the leadership here, I'm talking about the community, the people at home. We had, just last week, we had one of the lowest infection rates of the entire country for communities that are 500,000 people or above. Think about that. In the entire country, we had one of the lowest infection rates. That's a testament to the fact that we don't take a political approach to our response to the virus here. We took a community approach, and then we're working to help each other. I look back at examples that we had earlier this year where we're thinking about how do we take care of our family when there are shortages at the grocery store, and you're going to store it, but not just how you're taking care of your family, but how you take care of your next door neighbor who might be elderly or might have another medical condition and can't go to the grocery store themselves. Leaving groceries on their front steps and helping them be able to manage that. Those are adjustments that we made as a community. It's a decision that we made as a community early on to work together. And I think it worked. And I think it worked because you can see, again, it's at numbers. It's also how we stand up against so many other states where you're seeing spikes all over the place. And you're seeing these real political conflicts over something as simple and easy as wearing a mask. So I want to, just close out by thanking the community here, thanking the residents here for working together, because of that togetherness, and also by building that capacity, even amongst all the various sectors here, the hospital systems working together and collaborating instead of competing, our nonprofit community working together instead of competing. We've started building capacity so that we can do things like setting up the clinics at those churches over the last couple of weeks. We can do initiatives like how we get out additional flu vaccines in the coming weeks and months. And we can also be talking about how do we celebrate Halloween and be able to still go out and participate in Halloween. We're not yet having the conversation about how to cancel it because we've managed to keep that spread low, and I have a lot of faith and trust that when our young people go out, they're going to wear a mask, they're going to stay with their families, and they're going to stay 6 feet apart from others. And the proof is also in how the schools have handled this. And I want to thank, again, the schools for the way they've done this, because there has not been a lot of evidence of a lot of spread within the schools. I'm not talking about the colleges or universities, but the K-12 schools. Yes, there are going to be students and there's kids who catch the disease, but we don't see a lot of evidence that it's spreading within adults. And I think that's also a testament to the hard work that our schools have done, our administrators, our teachers, all of the professionals who work in the school buildings. They've just done a phenomenal job. And also with kids, I know this isn't easy. My kids are in school too, and they have to wear a mask all day. And that's not easy to do. But they're all working together, they're getting through it, and they're keeping that down. So I want to thank, again, the educational system, the community, and really all the nonprofits and everybody for working together because we kept it low. But Gino, to get to the heart of your question, we have to continue to work together to do that. We cannot let COVID-19 become a political issue. We also can't let it be a back burner issue, because as we head into the winter, it'd be far too easy for this to just start to spread because we all move indoors. So as we move indoors, we have to go back to the lessons that we learned earlier this year of what worked and what didn't work. And what we know worked was wearing a mask, keeping a distance, and using the hand sanitizer as much as possible. So I don't know if Dr. Mendoza had anything else to add, but.
No. Thank you very much, County Executive Bello and Dr. Mendoza and members of the press. That's it for today. We'll see you here next week.
Thank you.